Hi, I'm Ridni Fernando, Resident Physiotherapist at Vigor Pain Management Center, Negombo branch. So today I'm going to talk about muscle pains that any of you all must have experienced throughout your lifetime. So why do you get muscle pain? The reason for you to get muscle pain is due to trigger points. And what exactly is a trigger point? So a trigger point is like a hyper irritable, hypersensitive knot in a tight band of muscle. So why do you think we get trigger points? There's actually a multiple reasons for you to get trigger points. It could be because of age. Aging can cause trigger points. Either you're a very stressed person, like you have maybe depression, anxiety, or maybe you're taking medication for any of the psychological diseases you might have. Your muscles will tend to get a lot of trigger points. Or maybe you're someone who overworks your muscles, like a sports person or a weightlifter. You will be overusing your muscles, which will cause micro traumas and your muscles to form trigger points. Also, if you are like a very sedentary person who does not do any stretches, or even if you're someone who lacks vitamins like vitamin C, D, B, okay, you are at high risk to get trigger points in your muscles. So whatever the reason, if you get trigger points in a muscle, you will usually have either localized or referred pain. So localized pain is you have pain in the area you have the trigger point. Referred pain is your pain is somewhere else and the trigger point is somewhere else. So how do we identify a trigger point? You can identify a trigger point when you palpate a muscle and you will see a very palpable knot. So when you palpate that knot, the patient will have like a jumping sign. The person will get startled by the pain that we elicit with just a small palpation. And so to get rid of these pains, you need to release this trigger point. There are a lot of modalities we can use to reduce trigger point. The first being dry needles. So this is the most effective and the fast effective mode of reducing trigger points. So here we are going to use a sterile acupuncture needle, and we will be needling on the trigger point to elicit a twitch response, and you will see the release of the muscle. That is one option. Also, we could use manual or like a manual muscle release technique, like a massage. We could also give pressure on the knot for some time and try to reduce the muscle knot. Also, we can do cupping. Try cupping. It could be dynamic cupping or the stationary cupping. Also, we can use an instrument, like we call this IASTM, instrument assisted soft tissue mobilization, where we use a steel tool to try to get to reduce the trigger point. Also, we do have quite a bit of electrotherapy modalities like IR lamp and the ultrasound machine, where we can use to reduce these trigger points. So whatever the modality we are using to reduce it, you can, with a couple of sessions, you will see the reduction in the pain and the reduction in the palpable muscle knot. So if you're someone who is suffering from muscle pain, and even if it's from a long time, or if it's recent pain, it's high time you see a physiotherapist and try to release these trigger points to get rid of the muscle pains you have. Thank you.